Now, Dr. Faiz is very energetic. He's very positive. That's why he's a part of our team, along with Dr. Saira, who are very passionate about what they do. But most of the GPs, they do face challenges. You've got busy life, you've got exam looming by, and there's always a bit of a toggle between whether it's a knowledge or it's a practice, how much a practice helps the knowledge to pass the exam. It's that conundrum which never solves itself. And then there is also requirements of CPD. Now, how about I tell you, we address all of those issues with one single course, which is our course, GP Essentials course. Now, it's going to go on for 12 months. Knowledge summarized. You don't have to go through the details. We will summarize every details for make it specific to the practice and specific to the exams that you're taking. And that's most of the exams across the board. Skills that you need, and you need to focus to be a proficient doctor whilst working in general practice. And as I said, all of the tutorials are optimized for your clinical practice as well as exam. Now, what will it do? It'll make you more productive doctor. You'll be more efficient. As Dr. Faiz was saying, there are different item codes. You'll know all of them while learning through this course. So you know how to build them appropriately. Okay. Now, these are all the guidelines that we're utilizing to make up this course. There's all Australian College of General Practitioners guideline. There's Royal General Practitioners guideline. There's NICE, there's books. So you don't have to go through any of them because we've gone through them. Now, how are we going to do that? So we're going to do weekly sessions, twice or 3 times sometimes. It's a 12-month online, but if you cannot attend the online session, you'll have the access to the portal, which will have all the guidelines, which I'll share the screen for, and it'll have all the recordings of the session that you missed out on. Now, I believe that if you are quizzed with the information can be very didactic, it could be very bland, but if you're quizzed, then that knowledge gets consolidated. Okay. So I think that's very important. We'll have MCQs throughout the course going on. Local GPs, like Dr. Faiz, there's some other GPs which are getting on board. So you'll have a big team to work on with every week. There'll be a new GP. They'll be sharing their pearls of wisdom of how to assess the case, how to manage the case, refer the case to the specialist back and forth, and how to build them. So as I said, you're learning from day one about the things which you never get to know from very early days starting here in Australia. Okay, so let's just move on. Yes, and I'm also going to have a specialist. So obviously I'm speaking as an emergency specialist, but we'll have specialists from, cardiologists, neurologists. They'll be coming in and doing consolidate. So this whole course is module based. So you'll have a cardiovascular module, neurology module, skin care module, oncology modules, renal modules. And I will have a specialist at the end of each module to tell you about the pertinent things that he finds the GP must know about his specialty. So you'll have, firstly, the learning from the GPs, then complemented by the Australian GPs in terms of billings and administrative side and managerial side of things, and then the specialist here in Australia, which will complete the cycle in terms of your learning experience. And then, yes, the CPD hours. So you don't have to worry about it. This one single course will cover every requirement of your CPD, both by APRA and RACGP. Now, there's an optional procedural skills workshop because, as you know, the Australian GPs are quite diverse in terms of their clinical practice. They're meant to be doing certain clinical procedures. And I am doing that procedural skills shop in Sydney. And that is due on 4th and 5th of May.
And I'm a graduate of National Medical College, and I graduated in 2003. I moved to Australia actually in 2011. So I started working in Australia in the hospital setup in Western Australia as a resident medical officer. And I was very early promoted to medical registrar job. And so I worked in the Australian hospitals in Western Australia almost 3+ years. And during that tenure, I was fortunate enough to work in one of the very remote area, Port Hedland. And over there, I came across the Aboriginal community as well. And that was the time I had the interaction with general practitioners. And I can tell you, because of my background from Pakistan, I never used to like the word GP, because my concept and my understanding was that GPs are the ones who graduate, complete their house job or internship, and they just sit in the community without any further training and start seeing the patients in the community. But when I came to Australia, I got to understand that there is a complete fellowship training program for the general practitioners. And if you really want to enjoy the medicine in true sense, dealing with every community from all age groups with multiple presentations and variety of cases, general practice is the best place to enjoy this medicine, where you can enjoy seeing various cases, you can enjoy the responsibility, and you can work as a central coordinator dealing with different specialties, varying from allied health specialists, which are physio, occupational therapists, dietitians, psychologists, and then dealing with the subspecialists, which are cardiologists, rheumatologists, renal specialists, psychiatrists, etc., to count few. So I then completed my, when I got my general registration, which was the end of 2014. So I started working as a general practitioner from December 2014. And since then, I'm working as a general practitioner in Australia. So it's been 9+ years. I'm in the general practice
Wonderful.
setup. I've already
That
completed
is
my
amazing.
fellowship in 2022. So at the moment, I'm working as a fellow general practitioner in New South Wales in Sydney. I'm based in Rooty Hill, which is one of the busy suburb in New South Wales, in the uh,
West of
metropolitan
Sydney, I
area.
think. Yeah.
And along with that, I'm working as a general practitioner supervisor as well. And at the moment, I'm doing masters in diabetes as well, and trying to complete my diploma for the dermatology as well. And so I've involved myself in multiple things. And Dr. Rizwan Qureshi has asked me to join this team to help the newcomers. And I think I'm very humbled to receive this call and this opportunity, because working in Australia for 9+ years, I can literally tell you that number one, you can enjoy the medicine um, very well working as a general practitioner. If you understand the role of the general practitioner, you will actually understand what is the worth of general practice, not only in Australia, but what is the importance of the primary health system for any um, health structure to be at par with the international level. If the primary health system is fractured, then obviously the presentations of the primary health system, they will end up going to the emergency departments, they will end up going to the subspecialists, and which will actually reduce the quality of the health provided to the community. So,
That's
and
right.
thirdly, um, when you will understand the role of the general practitioner, it's not just a simple thing like that we are just giving Panadol for the headache, or we are just giving the conservative management for the flu. It actually deals from multiple like presentations. There can be some acute cases, yeah, yes, flu, diarrhea, where we will give the conservative management along with the medical certificate. But along with that, there can be emergency presentations to the general practices as well. Like there will be some person who will ask you to give me the referral for ophthalmologist, but as a general practitioner, you are not sitting there just to provide the paper. You have to ask the patient,
Mm.
why do you want to see the ophthalmologist? Patient may tell you that since last night, I'm having the curtain in front of my eye and I can see the black dots. It's not the referral to the ophthalmologist, it's the referral to the emergency department, because this patient might be having the vitreous hemorrhage. So as a general practitioner, you have to pick up that I'm not just going to do whatever the patient is asking me. I have to use my clinical judgment, and I have to manage the patient according to the evidence-based medicine. So in Australia, we work as per the guidelines, and what is these guidelines are definitely derived from the research studies, and this is the system that we follow in Australia. And along with the acute presentations, then you can deal with various presentations from diabetes, hypothyroidism, asthma, COPD, heart failure, management of the patient's post heart attacks like myocardial infarctions or angina after getting the stents or after getting the coronary artery bypass graft. You should know what are the medications. You should know what is the care for these patients after the discharge from the hospital. Along with that, the diagnosis of various rheumatological conditions, musculoskeletal conditions, etc., to count few. And in the management of the chronic diseases, you will be the one to make the diagnosis. Like the rheumatological conditions are mostly diagnosed in Australia by the general practitioners. Even the conditions like celiac disease, conditions like inflammatory bowel diseases, these are diagnosed by the general practitioners. And how we usually diagnose these conditions in various presentations, we need to learn the approach, how to like take the history, how to do the physical examination, investigations, and management. And we can only pick up these cases if we are following the guidelines. And during for the management of these patients, obviously there are some presentations where you can manage the patients on your own. For example, basic asthma and COPD managements are done by general practitioners in Australia. Even the diabetic patients are managed by general practitioners in Australia. General practitioners should know when to start metformin, it is the first line drug, then when to add on the second line medications like the new drugs, SGLT2 drugs, GLP-1 and DPP-4. We should know what are the contraindications, what are the indications, what are the benefits of these medications, and when these medications should be prioritized, when these medications should not be given. And along with that, like even the hypothyroidism is managed by the general practitioner, but there are criteria when to refer these patients to the subspecialist. And I'm again repeating that when there is a strong general practice system in any country, there will be a much better quality of health being provided to the community. I'll just give an example of hematuria. Yes, as a layman, anybody can decide, oh, I need to see the urologist, I need to see maybe the renal specialist. But it will be actually the general practitioners to decide, number one, maybe this patient does not need to see any subspecialist because the hematuria might be transient due to the recent participation in the marathon race, due to some dehydration, or due to doing some heavy work of doing some shifting of the home. So that hematuria, incidental pickup of the hematuria might be incidental. Number four, it could be urinary tract infection. Again, here the general practitioners can easily treat the urinary tract infection. Number four, it could be the renal stone as well. And maybe here again, still the patient does not need to be referred because the stone size is less than 7 millimeter, number one. Number two, there is no renal impairment. Number four, there is no urinary tract infection. And number 4, 5, whatever the counting I'm done, like there is no hydronephrosis as well. Correct. Number five, no, there is a need to refer to the subspecialist, but how will we decide that this patient needs to be referred to the renal specialist or the urologist? Again, here, we will do the RBC morphology. If it's a glomerular bleed, more than 80% of the glomerular red blood cells, it's a pure nephrology case. We have seen the proteinuria and the hematuria together. Again, this patient straight away needs to go to the nephrologist again for the renal biopsy. And then there is 20 to 80% of the glomerular cells. Now it could be renal or the urologist, or less than 20% glomerular red blood cells. Then this case is the urologist. Again, here we are not just going to straight away throw the patient to the urologist. We will be arranging these that called we will be doing the CT scan of the kidneys with the angiogram. And secondly, we will be doing the urine, we will be sending the 3 samples of the urine for the malignant cells to the lab. And once we have the answer, we will send the patient to the urologist with the complete workup. So this is how the huge responsibility, which you will actually enjoy if you want to enjoy medicine in Australia. So along with acute conditions and the chronic conditions, then there are the work cover cases. There are motor vehicle accidents.
Hmm.
which you and you can see these patients on
Yep.
the insurance, and you should know the system, that what is the how these patients have to be enrolled with the work cover, how these patients need to be enrolled with the compulsory third party insurance, what are the applications to initiate the process with the insurance, and how these patients receive the certificate of capacities during all this tenure in liaison with the allied health teams. You will actually get the feedback in the musculoskeletal. You will get the feedback from the physiotherapist or the occupational therapist about the capacity of the patients, and you will gradually up titrate that capacity in coordination with the allied health teams like physio and occupational therapists and orthopedic surgeons. And then who can know better than general practitioners about the preventive care, which includes immunization, which include the screening, and the screening in Australia is obviously the at the age of 50, every patient has to get the fecal occult blood test every 2 years,
Yep.
and every female has to get the mammogram every 2 years for the for the screening of the breast cancers. Along with that, there is screening for the prostate cancer as well, in which we discuss with the patients about the benefits and the side effects, and then we offer that screening as well. Along with that, recently I was actually going through some of the topics yesterday in the airplane, that actually every patient more than 65 should be screened yearly for the pulse rate and rhythm, and a cardiovascular examination to screen for aortic stenosis, to screen for atrial fibrillation as well.
Wonderful.
We actually do the teleconferences with the subspecialists, with the community nurses, for the patients of the diabetes and for other presentations as well. And then there are case conferences in work cover injuries, work related injuries, as well as in the motor vehicle accidents as well. And along with this, the general practitioners, when they see the patients, there are some item numbers that we charge through the
Hmm.
Medicare um, to the government actually. And there is a consult, there are basic consults of less than 5 minutes, more than 5 minutes, more than 20 minutes, and then more than 40 minutes and 60 minutes. And there
Hmm.
are different rates of these consults, from ranging from 18.95 to $191.2. Along
Hmm.
with this, there are actually, the rates are more when you're working in the after hours. And then there are different rates for the same duration of consults for the when you're visiting the residential care facilities, or if you are even visiting the hospitals as well. And along with this, when you're working in the community, and sometimes many times actually you get the request for doing the home visits as well. Yes, you can maintain your lifestyle, and you can refuse as well, and you can tell the you can tell the patients that they can contact the after hours services. But if they are your regular patients and you are free, you can actually have always have a small bag in your car, and you can just quickly go and visit them. And then again, there are item numbers for those home visits as well. Along with
Hmm.
this, even when you do the ECG, spirometry, and you do
Suturing
health
as well, I think.
assessment,
Hmm.
from again less than 30 minutes, 30 to 45 minutes, 45 to 60 minutes, greater than 60 minutes. These are very good items to build, because there are very good incentives to do those health assessments, and those health assessments are for 45 to 49-year age people, in which you can guide them about the upcoming screenings after the age of 50. And I forgot to mention about the DEXA scan after the age of 70. And
Hmm.
you can talk to them about the vaccinations we start after the age of 50. And along with that, you can do the OST risk tool for doing the diabetes risk assessment, for doing, and you can do the cardiovascular risk assessment scores as well by doing those
Hmm.
health assessments. Then there are some care plans which you actually make for the chronic disease conditions like
Hmm.
diabetes, chronic musculoskeletal conditions like even osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, and celiac disease, asthma, COPD, ischemic heart disease. So when you make those care plans, again, there are big incentive. When you make the care plan, you get something like $168.4, and when you involve the allied health teams through the team care arrangement, you get around $125.65. When you revise these plans again, you get close to approximately 160 something dollars. And along with this, when you make these care plans, you you can coordinate, you get the correspondence from those allied health team members or subspecialists. Then there are some other care plans that you can make. There is mental health care plan, which there is a different rate for the different rate for the patients you have seen for 20 plus minutes, different rate for the patient you have seen for 40 plus minutes. And you can make the aboriginal care plans. And then you there are some patients who come back after seeing the psychologist, after seeing the psychiatrist. There is a different rate for seeing the patients where you are involved in doing the counseling session, in doing the follow-up management for those patients with the depression, anxiety, psychotic conditions like schizophrenia, and bipolar disorders. So I don't want to overkill at this point of time. I think this is quite a lot to digest, but I'm just trying to give an idea that how much is the worth of general practice in Australia, and the people who really love to enjoy the responsibility, who are all rounders, who enjoy working in different varieties of work. They are the best suitable candidates for this job. You can work even as a, like I'm working as a GP supervisor with the Royal Australian College of General Practice. If you learn, if you want to actually, if you enjoy teaching the junior doctors, if you want to especially keep yourself up to date with the medical knowledge, and especially you want to give back to the community, I think doing a job as a medical supervisor is one of the best place to not only to keep yourself up to date, but to actually give back to the community as well. What you have actually, like, I'm very thankful to Australia to learn evidence-based medicine. And I think this is the best way I can give back to the community, by supervising the junior doctors, by helping them passing their fellowship exams. And what I just mentioned is actually the tip of the iceberg. We definitely need to go through the training. And I think what I understand, what Dr. Rizwan Qureshi is trying to do through this GP clinic essentials courses, to actually take you all through this journey and make it easy for you to acclimatize according to the working environment in Australia. And when you work in Australia as a general practitioner, even you do the wound repair for a small cut less than 7 centimeter, more than 7 centimeter, you remove some foreign body from the eye, you remove some foreign body from the ear, you do some aspiration of the hematoma, you do the incision and drainage for the abscess, you insert the implant for the ladies, ladies who want to do that for the contraception or other reasons. There are different item numbers. In spite of all this, more than 65% of the general practitioners in, I'm not sure, in New South Wales or in Sydney, they are actually charging the gap fee as well. So when you actually start as a general practitioner, you can initially work as a pure bulk billing general practitioner, where you don't charge extra to the patient. But once you become famous as a general practitioner in the system in Australia, you can actually start charging the gap fee as well. And you can really enjoy good quality of life as a general practitioner by earning good amount of money. And number two is you can enjoy a good quality of life as well. You can decide your lifestyle, that you only want to work in the business hours. You only, for example, want to work part-time. You want to work part-time for the seeing the patients in the community. You want to do part-time as a GP supervisor, and you also want to do some of your own investments as well, like doing masters in diabetes, or you want to do some diploma. There are various opportunities available for the general practitioners, not only in Australia, but you can actually enroll yourself with the courses ongoing in England and Ireland. And like I'm doing masters in diabetes at the moment. It's a very busy course. I'm not sure I will be able to complete it or not, but I will try my best. I'm doing this through the iheed.com. It's one of the I think this is one of the private uh, source in Ireland actually, and I'm really enjoying doing this. We have to remember that when we are doing when we are a medical students, at that time we are learning the pathophysiology of the conditions, how to diagnose them, and how to do the basic care. And when we start working as a doctor in the community, we need to follow, we need to use the clinical judgment to approach the conditions. And when we give the management, we have to follow the guidelines. And then there is a level above than this as well, that we try to participate in the ongoing educational courses where we can learn actually how these guidelines have been derived through the uh, research studies, through the meta-analysis, through the random control trials. So you can actually enjoy working as a general practitioner in various variety of roles. And being part of general practice system in Australia for more than 9 years, I can really tell you that this is one of the best profession to enjoy medicine and to enjoy the responsibility and to be a part of the community where the people will be thankful to you for diagnosing their difficult conditions, helping them by your own skills, by involving the allied health team members, and by involving the subspecialists. And you can earn the respect, you can earn the good amount of money, and you can enjoy one of the best lifestyle working in Australia. And due to my background, my father worked as a general practitioner in Saudi Arabia. My older brother is working as a respiratory specialist and intensivist in United States. So I have been to these countries. I've been to Middle East. I've been to America. I've got my colleagues in England, Ireland, New Zealand, and South Africa as well. And I've discussed with them how the system work in their countries. I can tell you, Australia is literally one of the best places to work as a general practitioner.
Thank you, Dr. Faiz. That was very good. And I feel like I need to become a general practitioner now. But, I tell you one thing. I have always maintained a very diligent eye on the practices and advancement in general practice because we get a lot of work from the general practice. I think general practice and emergency department are like sister specialties. Our overlap in terms of diseases, you are looking after the preventative side of things and the chronic health man. We are looking after the acute side of things, sending back. There is no healthcare plan which is complete, which we do unless and until we involve the GP or any of the hospital doctors can make a complete plan without involving general practitioner. So I would like to thank you very much. I know that your time was very difficult because you were in between flights and I'm very thankful. So guys, I'm very excited to welcome Dr. Fayiz Qureshi. I'm Qureshi as well. We are not relative in blood, but we are good friends. So Dr. Fayiz Qureshi will be as a part of our faculty and will be spearheading the course along with Dr. Saira. And there'll be some other Australian GPs as well. So when you're coming in from overseas, working in Australia, you'd know how to properly assess the patient, how to assess and be efficient. I'll take you through that, but I'll say goodbye to Dr. Faiz because he might be time pressed, and I'll take the rest of the presentation. Thank you, Dr. Faiz. Assalamu alaikum.
Thank you so much, Dr. Rizwan.
You're more than welcome to stick around. You're more than welcome to stick around, but if you want to go, that's up to you as well.
All the best to all the general practitioners who are looking towards starting their career in Australia. And I can really reassure all of you that Dr. Rizwan Qureshi will be really an excellent resource to work with. I've been listening to Dr. Rizwan Qureshi videos for some times. And as a busy person working as a general practitioner, I've never been able to watch the complete videos of any doctors. But Dr. Rizwan Qureshi is one of the doctor who actually, once I play the videos, I actually listen to those videos till the end. So Dr. Rizwan Qureshi has really got an excellent talent of like doing his presentations and taking you along in what he's trying to explain. So all
Thank
the
you
best
very much.
to the doctors and to the GP Clinic Essential team. And I'm very humbled to receive this offer. And I will try my best to give my best input for this really noble cause.
Thank you very much. Thank you very much, Dr. Faiz. And look after yourself. We'll catch up when you're back in Sydney.
All right. Take care, everyone. Goodbye. I'll go to sleep because I've just traveled last night. So I'm suffering from jet lag as well. But next time, if possible, I'll try my best to be the part of the whole Zoom conference. Thank you.
Excellent. Thank you.